Patient-reported outcomes can be collected before a clinical visit to improve participation and patient convenience. Engage the whole clinical microsystem to achieve optimal patient participation. Pro collection can be integrated into your existing workflows and need not place an undue burden on office staff. Our pre-visit pro collection process integrates into your existing workflows. Let's review each step of our process. Begin by identifying patients with an upcoming appointment. Run a weekly report of patients with upcoming appointments or ask front office staff to prepare a list, then send the pro survey. Many electronic medical records can auto-generate an email or text, or you can manually push out a message. Send the pro with a friendly reminder. A message from the clinician helps generate a response. Patients who don't respond to an email or text may respond to a phone call. Voice messages can be automated similar to calls for visit reminders. Next, identify patients who forgot to complete the pro before their visit. Run a report each day of patients who still need to complete the pro and provide it to your front desk staff. Support staff can ask patients to complete the pro in the waiting room. An important step is to provide the clinician with the pro results. The rooming nurse should be sure the clinician has the pro report. This way, the clinician can review the pro results with the patient. When the pro is used during the visit, patients are more likely to complete subsequent pros. For example, pros distributed to assess post-treatment health are more likely to be completed if the patient has seen how the pro informs their care decisions. Visit our website for free downloads you can use to support your pre-visit process or request a consultation with our team to learn how we can help you implement our methods.